COVID-19 nCoV in China seems to be largely limited to family members, healthcare providers, and other close contacts and is probably being transmitted by respiratory droplets. WHO officials project that the outbreak is containable if that pattern holds. Severe cases in China have mostly been reported in adults older than 40 years old with significant comorbidities and have skewed toward men. A family cluster of infections has been recently described, including a child with asymptomatic infection. An initial report of 425 patients with confirmed 2019 nCoV infection in Wuhan, China, attempted to describe the epidemiology. Many of the initial cases were associated with direct exposure to live markets, while subsequent cases were not. This further strengthens the case for human-to-human transmission. The incubation time for new infections was found to be 5.2 days, with a range of 4.1 to 7 days. The longest time from infection to symptoms seemed to be 12.5 days. At this point, the epidemic had been doubling approximately every 7 days, and the base reproductive number was 2.2, meaning every patient infects an average of 2.2 others. Further data will likely better define the clinical course, incubation time, and duration of infectivity. Diagnostic testing. The CDC has developed a diagnostic test for detection of the virus and has requested special emergency authorization from the FDA for its use. The test is a real-time reverse transcription polymerase chain reaction (RRT-PCR) assay that can be used to diagnose the virus in respiratory and serum samples from clinical specimens. Of note, commercially available molecular tests for respiratory viruses, even those detecting endemic coronaviruses, have not demonstrated the ability to detect 2019 nCoV. Australian scientists have successfully grown the virus in cultures. Treatment of 2019 nCoV infection. No specific antiviral treatment is recommended for 2019 nCoV infection. Infected patients should receive supportive care to help alleviate symptoms. Vital organ function should be supported in severe cases. No vaccine is currently available for 2019 nCoV. Avoidance is the principal method of deterrence. Infection control. Patients who are under investigation for 2019 nCoV infection should be evaluated in a private room with the door closed. An airborne infection isolation room is ideal, and asked to wear a surgical mask. All other standard contact and airborne precautions should be observed, and treating healthcare personnel should wear eye protection. Thank you for watching. Be updated and wait for my next video. Thank you.